afternoon. I'm Dr. Alia Reddy speaking from FemCity Hospital, Hyderabad. I'm an infertility specialist. I would like the females over there to bring little awareness to them, like when they should visit an infertility specialist. I want them to know that few signs are there where they should be aware of, and should be, prompt enough to say, okay, I'm now suffering from infertility, so I have to visit an infertility specialist. So I'm speaking about those few signs which all of you, after marriage or before marriage also, after menarche, you just keep observing this. Like we keep telling for the breast cancer that you have to examine yourself every day. The same way we tell all the girls who have attained puberty or who are in the marriageable age, you please be aware of these few signs which I am speaking to you, like when you have to visit a doctor, a gynecologist or an infertility specialist. And these are the few things, like when you have an irregular period, whether it is only period with 2 months, 3 months, or only you are having period with after using medicines, or there is a total amenorrhea. This is the time you have to think about that there is something wrong with me, or the parents also should listen to this and feel that there is something wrong with my daughter. So let us visit a doctor and find out what it is. See, everything what you take initially and take a prompt action, that will help your child or yourself in dealing with such problems. Second is, like if you are having a painful period, or period is very heavy, or there is a pain after having a intercourse, you have to think about visiting a doctor. That infertility ho, kuch bhi ho, but these are all related to infertility. These are the signs which your body will tell you. Now this is the time you have to visit an infertility specialist. Or there is a gain of weight. Suddenly there is a gain of weight, or you are losing your weight, or there is a loss of hair. Your hair, you're having a hair fall, or there is a extra overgrowth of hair on your chin, on your upper lip. This is the time you have to think that something is going wrong with my body, so I have to attend a doctor. Now I'm telling you, I'm explaining to you in detail. When I said there is irregular periods, or there is periods only with the use of medicines, or there is amenorrhea, these signify that you are suffering from polycystic ovarian. What you people will be listening, PCOS, when there is a hormonal imbalance. So because of the hormonal imbalance, you don't have periods, or you have total amenorrhea, or you have periods only withdrawal period after giving medicines. Now when you speak about having a painful period or a heavy period, it only signifies that there is a chance of you having an endometriosis in your pelvic region. So these signs, your body is telling you, I'm suffering, so better show yourself. So this signifies that you have some endometriosis. Or there is a sudden gain of weight, or you're suddenly losing your weight. This shows that there is some problem with thyroid hormone. So either it could be hypothyroid or it could be hyperthyroid. So with that, the androgen, and then there is a hair loss, or there is a extra growth of hair on your lips. These symptoms, what they show, that there is an increase in your male hormones, that is androgens. So you have to, so you know your body is telling you these are the things, something is going wrong. You have to show yourself, you have to correct yourself. The earlier you correct, the better. So now coming to the couple having a child. See, after marriage, the couple enjoys and they decide now is the time we go for a family. For some it is a joyful thing, they immediately conceive. For some it might take some time, but few of the couples, they need an IVF, the help of an IVF specialist. Like with the help they can't move on. So those are the couples who have to come to an IVF specialist, and when the IVF specialist does investigations, does a scan and examine them and tell them, now you have to go for an IVF treatment. IVF treatment itself is a very painful procedure. It is a toll on the female because she is the one who has to undergo all the investigations, the scans, the pickups, the transfers, and all the things she only has to do. So it will take on her physically, emotionally, and financially. So the couple has to, for in that situation, the couple has to have a very supportive partner who can understand her, who can help her in coming out of that problem. See, when in the family, let's say that a person is having or going for an appendix pain abdomen and she has been advised an appendicectomy. How the family supports her? They take her to the hospital, they speak to the doctor, the whole family goes there supportingly that nothing will go wrong. Once the appendix is removed, you will be normal. So it is the same with IVF. The society, the family, everybody should understand that because there is a problem with the couple, they need this treatment, and it is nothing. It's not a vibe to have like not having a child. You will have a child if you have a uterus and ovaries. So it's not a big crime not having a child or going to an IVF specialist or getting an IVF treatment done. So the family has to support them, give them. Don't see that the girl is stressed up. She is made to understand. She is made to be motivated. Like this is the path you have to take. The husband or the partner, or she should have a very good friend or a mother-in-law, whoever it is, have to be supportive to her and see that she crosses that IVF treatment in a nice way, because it's an invasive procedure. It takes a time of 15 days where she has to come, take the treatment and wait for the results. So if she is having a stressful life, what the IVF specialist will try to help her will be a waste. So she should be stressless, she should be happy, she should have confidence on herself and her body that now I am going to become pregnant. And she has to have a balanced diet, eat proper diet, proper timing, and have a good sleep. So all these factors will help her in achieving a baby. And if a male partner is a habit of having a smoking or alcohol, he is advised to stop it till the time she is undergoing this treatment, because that has an impact on the oocytes and the sperms. So few lifestyle changes, and if the patient is obese, she can lose her weight before she is going for this treatment, because it is just not losing at a drastic level. Losing 5 kgs also would help her in achieving a pregnancy. So it is not not a vibe to go for an IVF treatment. It is helping you in achieving without wasting your time, without dumping you with so many drugs and all that. Simple IVF where you can have your baby in the right age and the right time. So people who have been trying to conceive below 30 can try for 1 year, and once they cross 35, they can only try for 6 months. And if they don't conceive, it is always nice for them to approach an IVF specialist so that they can help us in saying that this is the problem, this is the problem, and this is how you have to go. So it's as simple as that. So don't think of IVF as a huge big thing, or it's a simple procedure where doctor helps you. Suppose you have a cardiac problem, the doctor helps you. You have orthopedic problem, a knee joint problem, the orthopedician helps you. In the same way, IVF specialist also will only try to help you in completing your family. So take it in a positive way. Be positive, don't have any stress, don't sit and cry at home. Please approach a IVF specialist so that we can help you. Now, I am coming here every Wednesday between 2 to 4. So, anyone who is in a need of a baby or who's been trying since long can approach me at this time at FemCity. Thank you.